Mabuhay! This study is entitled In My Medical Kit, a phenomenology on the spirit of volunteerism of volunteer Filipino healthcare professionals in Tingloy, Batangas.
Volunteers are individuals willing to serve anyone, even in far-flung and dire situations. Although traditionally, a volunteer receives no compensation, Rosenthal stated in his research in 2015 that a volunteer can be paid expenses, receive benefits, or a nominal fee or any combination to perform services. Notions of Filipino volunteerism are widely shown in the concept of bayanihan. In 1989, Andres defined bayanihan as a Filipino value that denotes camaraderie among the people of the community in helping one another in times of need. In contrast to the ideal setup, Filipinos slowly pretermit the once rampant tradition. In Ang's study, he asserted that the kanya-kanyang kayod system is now the dominant characteristic of the modern day. Now Filipinos become self-driven, doing things towards oneself. In the context of volunteerism in the healthcare system, there are only a few volunteer healthcare professionals in the rural areas. To be precise, as of 2019, there are only 215 active volunteers in the Philippines under the Doctors to the Barrio program. Hence, this study addressed the problem: what is meant by being a volunteer healthcare professional in Tingloy, Batangas.
This study aimed to identify what it takes to be a Filipino healthcare volunteer, the skills required in the field, the risks and sacrifices to be done, and the experiences enacting volunteerism in the rural area of Tingloy, Batangas. This study can also be used to propose a training program that will ablaze the spirit of volunteerism in the hearts of Filipino healthcare professionals and students of medicine.
To gain an in-depth understanding, the qualitative research was adopted that incorporates interview, immersion, and observation. Qualitative research focuses on meaning-making, and it is used since the spirit of volunteerism is a lived experience which cannot be measured in numerical terms. According to Sargent, qualitative research should be conducted with purposive sampling to make sure that the co-researchers fit the criteria and are suitable for the said study. In addition, using purposive sampling ensures thick and substantial data from the co-researchers.
For this reason, the co-researchers were selected based on the following inclusion criteria: a licensed nurse or doctor currently serving in the RHU of Tingloy with at least 2 or more years of experience volunteering in rural areas in the past. They must be able to clearly state their experiences as volunteers as well as how they started volunteering in rural areas in order to help produce an accurate diagram and program. After selecting the co-researchers and identifying those who are volunteers, apart from those who are locally hired, the volunteers in the municipality of Tingloy were interviewed individually. 1 out of 9 volunteers was a doctor, while the rest were nurses. Only 3 of these nurses were women. 5 volunteer nurses and 1 volunteer doctor started serving in the RHU last August 2017. 2 other nurses are in their 4th year of serving, while 1 remaining nurse has been serving in the RHU for 8 years. By interviewing all volunteers in the island, the data was saturated after gathering data from the 8th co-researcher.
Aside from the practicality, Tingloy, Batangas was chosen as the study site because it is one of the places in the country classified as a geographically isolated and disadvantaged area. In addition, in the whole Marikaban Island, there's only 1 healthcare facility, specifically Tingloy RHU.
For the data collection, the co-researchers were searched and contacted first. After asking for their permission and them giving their consent, their daily routines as volunteers were observed through participant observation. This is done in order to uncover the different challenges they may face, as well as the distinct characteristics and behaviors they may exhibit. In addition, the researchers immerse themselves into the daily lives of the volunteers, observing first-hand interactions with patients and how they cope with the workplace environment, considering the technology and equipment present, or lack thereof. In order to concretize and support the observation, an interview was conducted for each volunteer wherein the questions revolved around their workplace and their lived experiences as volunteers at Tingloy RHU. Georgie's method of analysis will be used to approach the findings. It is stated by Beck that Georgie's method, in contrast to Colaisis, believe that it is not appropriate to ask for members' validation regarding the findings because the co-researchers describe their experiences based on an everyday perspective. Through this, we can avoid bias when it comes to validating the data gathered.
As the research was conducted, the LLL diagram was created. This visualizes the findings of the study regarding on what is meant by being a volunteer Filipino healthcare professional in Tingloy, Batangas. Layers of circles were utilized to show the manifestation of a components emanating from its core. This symbolizes that one's morals and values strengthens the spirits of volunteerism, and this is called the lalim, thus enabling one to develop the skill sets required for the job, realizing the challenges and sacrifices to be made, and the fruits of labor called the loob. And finally, serving the community with the heart of a volunteer by physical means called the lingkod. Aside from this, the circle symbolizes the wholeness of the components, as they are all needed to be a volunteer Filipino healthcare professional at heart. The core of the diagram symbolizes the values and ethics that strengthen the volunteer's will to serve. Lalim encompasses the different morals that spark a volunteer's will to serve the underserved, which is then manifested as the characteristics and attributes that are essential in getting through the struggles they face every day. The loob is a component manifested by the values and morals encompassed by a volunteer's lalim. Because of the innate morals and values of a volunteer, one can develop his own skills and knowledge, one can realize the challenges to be faced, the sacrifices to be made, and finally, the fruits of his labor. With this analysis, it can be said that without one's lalim, the volunteer's loob cannot flourish, since the strong foundation and the drive for his development, which is his own morals and values itself, is lacking. The outermost part of the diagram represents the manifestation of the lalim and the loob. Lingkod focuses on how these volunteers interact and give service to the people of Tingloy. Lingkod encompasses the physically visible manifestations that includes service to the people, relationship with peers, and contribution to the community. Lingkod is the last essential part for one to be deemed as having a heart of a volunteer Filipino healthcare professional. Without these physical manifestations of the lalim and the loob, the application of the will, skills, and the awareness to the situation would be of no use. To better understand the LLL diagram, here is an example of the connection between the three. Resourcefulness is one of the examples of lalim, and because of this, it has been inferred that lack of support from the government and the lack of manpower were some of the problems encountered in the workplace, all of which under loob. Due to these problems, Lingkod, through combined efforts of the community and the RHU, emerged. Specifically, in case of emergencies, some tricycle drivers willingly gave their contact numbers and boat owners readily lent their resources, which allowed sea ambulances to happen.
Based on the findings, the proposed training program will be entitled In My Medical Kit, Ablazing the Spirit of Volunteerism. It aims to tell aspiring volunteers on what they need to prepare before embarking this path. There will be a seminar discussing on what it takes to be a Filipino healthcare volunteer, a training segment allowing the participants to learn the essential skills by having an on-hand experience, and a talk between the participants on why they decided to join the program in order to widen the views of their fellow aspiring volunteers. It will be a month-long training program conducted in a rural area to allow aspiring volunteers immerse themselves in grassroots levels. Current and previous volunteer healthcare professionals would also be invited to talk regarding volunteering in the span of the proposed program.